You know, when you see your best friend shaking, it's just plain unsettling. Your mind can immediately jump to the worst-case scenario, and it's a moment of helplessness that, well, pretty much every dog owner has felt at some point.
And that's probably why you're here, right? Asking this exact question. You need answers, and you need them fast. Okay, let's dive in and figure this out together.
So here's the thing. Shaking can mean anything from, oh my gosh, you're home, to a serious medical emergency. Now, in this explainer, we're going to use shaking as a kind of catch-all term, but we'll break down all the possibilities, from the totally harmless shivers to more rhythmic tremors, all the way to those critical signs you absolutely cannot ignore.
All right, first things first, let's talk about the good stuff, the times when you can probably take a deep breath and relax. Because not all shaking is a bad sign. Actually, sometimes it's the total opposite.
Just think about it for a second. Does your dog start trembling the moment you even look at the leash, or the second your car pulls into the driveway? That is probably pure, unfiltered joy. Shaking can also just be a simple response to being chilly, or maybe they're just wiped out after a huge day at the park. Even anxiety, or just getting older, with weaker leg muscles. These are all totally normal parts of being a dog. I mean, this quote really says it all, doesn't it? It just shows how intense their emotions can be. If a dog's excitement can literally overflow like that, then a little bit of shaking, yeah, that's completely understandable. It's just their body's way of dealing with a huge feeling.
Okay, but what if the shaking doesn't really fit into those happy or harmless little boxes? This is when we have to start thinking about the times shaking might be a signpost, a symptom of a much more serious medical issue going on. So one of the big, scary ones we have to talk about is canine distemper. It is a really nasty virus. It's actually related to the measles virus in humans, and it attacks multiple systems in a dog's body. It's especially dangerous for puppies and for any dog that hasn't been fully vaccinated. The signs of distemper are tricky because they often start out looking just like a bad cold. A fever, goopy eyes and nose, a cough. But the real giveaway and the reason it causes shaking are the neurological symptoms that show up later. We're talking about things like myoclonus, which are these very distinct, jerky muscle spasms, and sometimes even full-blown seizures. And here's one of the most telling long-term signs of distemper, the damage it can do to their teeth. If a puppy gets the virus before their adult teeth have come in, it can actually damage the developing enamel. It leaves their teeth pitted and weak for the rest of their lives. It's a permanent physical reminder of the disease. Okay, another condition you might hear about is white dog shaker syndrome. Now, right off the bat, that name is a little misleading. While it was first noticed in small white dogs, like Maltese and Westies, it can absolutely affect any dog, any color, any breed. It's basically an inflammatory disease of the brain, specifically a part called the cerebellum, which controls all their coordination. So, how in the world do you tell these two apart? Well, the biggest difference is the cause. Distemper is a virus, and it has this huge range of symptoms. Shaker syndrome, on the other hand, is thought to be an immune system problem that primarily just causes tremors. And because the causes are so different, the treatments are too. Shaker syndrome often gets better with steroids, but with distemper, it's really all about supporting the dog's body while it tries to fight off the virus itself. Okay, we need to shift gears now and talk about the real emergencies. These are the situations where there is no wait and see. This is when you have to act, and act fast. And I really want to be clear here, this is not an overstatement. Sudden, violent shaking can absolutely be a sign that your dog's life is in immediate danger.
It's scary, but so many things in our own homes can be toxic to dogs. We're talking about chocolate, the sweeteners xylitol, nicotine from cigarettes, even certain plants. If your dog suddenly starts shaking and it's paired with vomiting, weakness, or a ton of drool, you have to consider poisoning as a very real possibility. The slide says it's a frightening experience, and honestly, that is putting it mildly. When your dog has a seizure, they're often completely unresponsive, and their body's just out of their control. It is terrifying and absolutely heartbreaking to watch. So, what does a big seizure actually look like? Well, a lot of the time, the dog will just collapse onto its side. Their body goes completely rigid, and then their limbs might start to paddle or jerk violently. They might also lose control of their bladder or bowels. Knowing what to look for is the first step in being able to help them. Okay, so you see your dog shaking, you're worried, you know it might be serious. What do you do right now? Here's your game plan. First and most important, try to stay calm. I know it's hard, but your panic won't help your dog. Next, think about their safety. If they're having a seizure, move furniture away or put some pillows around them so they don't get hurt. Then, become an observer. If you can, take a quick video with your phone and make a mental note of every single detail. Finally, call your vet. All that information you just gathered is going to be absolutely vital for them to figure out what's going on quickly.
And please, please listen to this. This is so important. Never, ever, ever give your dog human medication unless your vet specifically tells you to. Common things like ibuprofen are incredibly toxic to dogs and can cause massive harm, making a really bad situation a million times worse.
Look, at the end of the day, being a great pet owner is all about being prepared for the unexpected. Knowing the difference between a happy little shiver and a serious neurological tremor. Knowing who to call, what to do in an emergency. That knowledge is your power. So the real question is, are you ready to be your dog's best advocate when they need you the most?